I can't wait for you to come my way.
Assalamualaikum warahmatullahi wabarakatuh. My name is Khairudin Adam bin Khairul Azma and I am from SR113 4B. Me and my group mates will present chapter 6, which is musculoskeletal injuries. We will present about bone fracture, dislocation and stabilization. So, for the definition of bone fracture, it is when a complete or partial break in the continuity of the bone. And there are two types of bone fracture, which is closed fracture and open fracture. For closed fracture, it is when the fracture does not penetrate through the skin, while open fracture is when the bone fracture and protrude to the skin, which means open fracture is when the bone penetrate through the skin.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Najiha binti Roslan. So I will explain about the sign and symptom of fracture. Okay, there are several signs and symptoms of fracture that can be seen and cannot be seen. First of all, such deformities occurring in the hand and the feet after a fall-like impact is a sign of bone fracture that can be seen. We can see the fracture area will change shape. Besides, the injured area will become swollen and bruised. Okay, the third is restriction of movement. We can feel the pain in the fracture part when we touch, press or move. As a result of bone fracture can cause restriction of movement. Okay, fracture also cause fainting, dizziness and shock due to ruptured blood vessels due to fracture. Okay, lastly is feel the pain fracture area. If the injury is a open fracture, we will see bone come out from the skin. It will make the patient cannot move.
6 types of fracture, which is transverse, linear, oblique, spiral, green stick and comminuted fracture. So let's go one by one. We start off with transverse. Transverse is when the fracture is perpendicular to the shaft of the bone. So the transverse fracture is like this. And the second one is linear, where the fracture is one thin line with no additional lines splintering from it. So the fracture is going upwards or downwards like this. And for oblique, is particularly prone to angulation. So when the bone is like this, the fracture is going angularly like this. Okay. So the next one is spiral, or also known as torsion fracture. This is when a bone fracture occurring from a strong force applied along the axis of the bone. So spiral is the bone getting with a force. So next one is green stick. Green stick is a fracture in a young soft bone in which the bone will bend or breaks. And last one is comminuted fracture. Is a break or splinter of the bone into more than 2 fragments. That's all for me. Thank you.
Warahmatullahi wabarakatuh. My name is Nur Al-Aini binti Roizan from SR11340. So, in my part, I'm going to talk about the causes of fracture. There's 3 causes of fracture in this slide. The first one is trauma, osteoporosis, and overuse. So, for trauma, broken bones happen to all people of ages. Most often, they occur as the result of automobile accident, fall, or sports injury. It is often considered as a traumatic injury. So that's what we call trauma, because the injury require a fast treatment. This is especially true if the fracture occur in the larger bone, like the humerus, femur or tibia and fibula, or if the broken bones break through the skin. So next, what is osteoporosis? Why osteoporosis can cause the fracture of bone? Osteoporosis is a bone disease that occur when the body lose too much bones. As a result, our bones will become more weak and may break through the fall, sneezing, or minor bump. And that's become a serious case. Osteoporosis means porous bone. If the healthy bone, it will look like honeycomb, as you can see in the slide. When the osteoporosis occurs, the holes and the spaces are become larger than a healthy bone. Osteoporotic bones have lost density or mass abnormal tissue structure. As bones become less dense, they will weaken and more likely to be break. If you are 50 and older and have broken a bone, you should ask your doctor about the bone density test. So next is overuse. So overuse is commonly known as a stress fracture. A stress fracture, also known as overuse injury. It occurs when muscle become fatigued and unable to added shock. Eventually, the fatigued muscle transfer the overload stress to the bone, causing a tiny crack called a stress fracture. So, what causes of the stress fracture? Stress fracture are commonly causes because of the individual do some activities or training with the intensity that rapidly, so it causes stress. They also can be caused by the impact of unfamiliar surface. So that is what it means by overuse. We are gonna talk about prevention of fracture. So the first one, you need to consume an adequate amount of vitamin D and calcium. It is because calcium and vitamin D work together to protect your bones. Calcium helps to build and maintain the bone, while vitamin D helps your body absorb calcium into your body. So even if you are taking enough calcium, it could be waste if you take the deficient amount of vitamin D. So it need to be balanced. Next, you need to exercise several times a week. Normally, they will exercise 3 times a week. Thirdly, you need to do medical checkup about bone density test. It is for you to check whether your bone is strong enough or not, and it can prevent osteoporosis. Lastly, you can ask your doctor about the medication to slow the bone loss and to reduce the bone fracture risk. So we are going to talk about treatments of fracture. The first one is activate the EMS. What is the EMS? EMS is Emergency Medical System. A fracture is a broken bone, so it requires the medical attention. If the broken bone is the major trauma or serious injury, you need to call 911 as the emergency in your country number. Is control bleeding. What is mean by control bleeding? When the patient is bleeding, we need to stop the bleeding because it's prevent from the blood loss too much. What you need to do is you need to apply the wound with the sterile bandage, or in emergency you can use the clean clothes or a clean piece of clothing. It will save the patient from loss many blood. The third one is cover the wound with the sterile dressing. Okay, the third point same with what I said in the second point, which is it can cause much blood loss if we didn't do that. So if we do this, it can prevent infection and blood loss. So it's important to sterile the dressing first. So the fourth one is make sure the airway is clear. Okay, what does it means by make sure the airway is clear? It means that we need to see that the patient can breathing or not. We check here the airway. If the casualty appears unresponsive, we need to ask them loudly and make sure that they are okay and can reply you and can open their eyes. If they respond, you can leave them in a good position until the help arrives. While you wait, you need to keep checking their breathing and their pulse, and then their situation and level of response. Are they alert Are they respond to you? Do they respond to your voice? Is there no response from them or no movement? It means that they are unconscious. If there's no response, leave the casualty in position that can open their airway. But take care not to move the casualty of their neck. Opening the airway, you need to take the priority of the neck injury first. This is known as the jaw thrust technique. Next, provide some form of immobilization with spleen. So, what does it mean by immobilization? It refers to the process of holding the joint or bone in place with spleen. This is done to prevent the injury area to stop moving while it heals. So, what is the purpose of immobilization? Spleen, casts, and braces are the support of the broken bones or dislocated joints and injured soft tissues, ligaments, or tendons. Immobilization restricts motion to allow the area of injury to heal. It can help to reduce the pain, swelling, and muscle spasms. Okay, the last one, make sure the patient is comfortable. That's the important thing if we treat people. Okay, that's all from me. Thank you. Assalamualaikum.
For the definition of dislocation, it is when a complete displacement of a joint from its normal alignment, while subluxation is a partial displacement of a joint from its normal alignment.
Assalamualaikum warahmatullahi wabarakatuh. My name is Putra Ibn Sufyan bin Saleh. In this video, I'm going to talk about the common part of dislocation and also the sign and symptom of dislocation. There are 6 common parts of dislocation injury, which is shoulder, hip, knee, elbow, fingers, and also hip. Inflexible structure tend to dislocate it more easily, such as fingers and also jaw. Ball and socket joint, where we can move in every direction. For example is shoulder and also hip. These two are similar. However, shoulder is tend to more easily pull out than hip. The sign and symptom. There are a few signs and symptoms that can be detected if someone get the dislocation. First one is pain. Second is deformity. Deformity is where the bone is not developed in the usual way. The third one is asymmetry. Asymmetry is if the bone, or we can see the part where it's dislocation injury is not in the same shape anymore or not in the same size. The last one is loss of normal contour. Loss of normal contour, usually we can see if someone get a dislocation at their shoulder part, where the shoulder became a stub. As we can see in the picture, they have different unusual shape at their shoulder. That's all from me. Thank you, and I will pass the next slide to Nata.
As we know, dislocation is where the 2 or more bones comes together, in which the end of your bones are forced from their normal position. So what causes of dislocation? Now I will explain about the causes of dislocation. Firstly, the cause of dislocation was trauma that forced a joint out of place. The trauma likely from the vehicle accidents, force from the height place, the pressure impact from the falls, and the contact sports such as football, hockey, and rugby are common causes of this injury. Dislocation also occurs during regular activities when the muscle and tendons surrounding the joints are weak.
Prevent a dislocation if you practice safe behavior. General tips to prevent dislocation include, but before that, let me introduce myself. Assalamualaikum warahmatullahi wabarakatuh. My name is Ismul Luqman bin Jamari, and I will tell you about the prevention and the treatment. Okay, for prevention, you must use handrail when going up and going down the staircase. This way, you will keep yourself balanced and safety with the handrails when you hold it. Second is keep a first aid kit in the area. If anything happen, you will get the early treatment stage using it. Use non-skid mat in the wet area, such as bathroom, to avoid slippery. Next is move electrical cord off the floor and avoid use of throw rocks. Take precaution to avoid falls. Always get your eyes checked regularly. Ask your doctor or pharmacy if any the drugs you take might make you dizzy. And be sure your home is well lit and remove any potential hazard in the area. And always play safe. Once you have dislocated a joint, you might be more susceptible to future dislocation. To avoid recurrence, do strength and stability exercise as recommended by your doctor and therapist to improve your joint support. How is a dislocation managed or treated? It can vary based on the severity of the injury and which joint is dislocation. Applying ice and keeping the joint elevated can help reduce the pain. There are 5 treatments that you will use. Treatment for dislocation that include: the first one is medication. Your doctor may recommend medication to reduce your pain from a dislocation. Second is manipulation. A doctor return the bones to their proper place. And third one is rest. Once the joint is back in place, you may need to protect and keep immobile. Using a sling or splint can help the area heal fully. The fourth one, the rehabilitation. Physical therapy exercise strengthen the muscle and ligaments around the joint to help support it. Okay, the fifth one is surgery. Your doctor may recommend surgery if the manipulation does not work to put the bones back in place, the dislocation damage blood vessel and nerve, muscle and ligament that need repair.
I can't wait for you to come.